we're going to go to our first guest because they are here. Um, and Kemba Gosier and Rep. Felicia Robinson are here to talk about their work around sickle cell advocacy laws that they try to get passed there in the Florida legislature, and also to an event to celebrate Kemba's organization that does work around sickle cell awareness that's coming up soon. So without further ado, I would love to welcome to the show and to the stage. The music is on in the background again. Okay, let's make sure we cut that off because we don't need that. That's good. I heard it, but I was like, what is that? Okay, so without further ado, thanks for that, Tontis. Without further ado, I would love to welcome to the show Kemba Gosier and Representative Felicia Robinson. Hey, ladies.
Hi, good evening.
Hey. Thank you guys so much for coming on. Today we rolling with the punches. We got a little bit of a late start, but I'm like, freaking, let's just start with our guest today.
Thank you. Happy to be here, Janey.
Thank you so much. Yeah, she is an advocate for sickle cell warriors, and we love the work that you're doing. And I really am so happy to have you both on because of the work that you guys were doing as far as creating laws and policy to help sickle cell warriors. So without further ado, let's get right into it. And Kimba, I'll start with you. For those unfamiliar, what does ASAP do day to day to support individuals and families living with sickle cell disease in South Florida?
Yes, thank you. I'm excited to be here again on your platform and super excited that this is our 10-year anniversary because we've been in the trenches doing the work for the last 10 years. ASAP stands for Advancing Sickle Cell Advocacy Project, and we're a 501c3 nonprofit organization established in 2015. We provide support services, programming, and resources for individuals and families impacted by sickle cell disease here in South Florida. And Representative Robinson will share some more information with you. So it's not just actually in South Florida, but we're working statewide to make a difference in the lives of individuals and families impacted by sickle cell. So we actually have 3 support groups. That's one of the areas that we offer support in. The support group is for adults, the general population, supporters. We also have one for teens and preteens. And most recently this year, we started a support group for individuals that are interested in bone marrow transplant or gene therapy, or they're interested in it, or either they have gone through it. We're very proud that a member of our organization actually recently went through gene therapy and actually no longer has sickle cell disease. So,
oh, wow.
Yes, Kaden, hi, if you're watching, hi, Kaden and Francita. So we offer that. We have a chronic pain self-management program that's free to adults. Well, age 16 and up with sickle cell is virtual, is free. We also have a program called Community of Parents Empowered, where we engage children with sickle cell under 18 and their parents with coping strategies. We engage them with art therapy, music, mindfulness. We added gardening onto it this year, and we have been a proud community partner with the City of Miami Gardens for a few years now. So they support a lot of our efforts and initiatives. I could go on for a long time, but those are some of our core programming that we offer. Also, scholarships. 2 years ago, we started scholarships for sickle cell warriors, not only warriors, but caregivers. If you have a loved one with sickle cell and you're trying to further your education, we have a Kevin J. Francis Memorial Scholarship that we offer, as well as we have a collaborative with nursing schools and medical schools as well. FIU, we have a partnership with them with their medical school where we teach their medical students, not necessarily say teach, but we hold workshops where we educate them on the impact of sickle cell and how it affects someone outside of the hospital setting.
Oh, love it. And so I would like to know, Rep. Robinson, how did you get involved in this work with sickle cell advocacy?
Well, for those of you that know me, although I am a representative and I am an educator, I think being an educator is what's most impactful in everything that I do. And so actually, when I was on the City of Miami Garden City Council is when I think I started working with Kemba in this fight. I recognize that your quality of life isn't good if you're not healthy. So when it comes to health, I will try to educate you, promote, support, give you resources in any way that's possible. So it's not only just one thing, but when it comes to the sickle cell thing, I recognize that sickle cell is a disease that affects people of color, majority, and it wasn't really being noticed or highlighted. It was just kind of going under the radar. And so when Kemba came up with ASAP, when I say this organization is amazing, they do it all. You heard all the different programs that she said, and she came and she needed some support for the city of Miami Gardens. It wasn't nothing I could do but help. And so once I started, I just never stopped. Anytime she calls or anytime they're doing something, I'm definitely there trying to push advocacy, give resources, educate in any way that's possible. There's so much that people don't know about this disease. So anytime that you can bring awareness or do something, I'm going to be at the forefront of that. Just to share a little bit about when I was on the city council, what I would do was I would support the different efforts they have, hosting things like that in education. But when I got to the state level, I was like, let's see what else could be done. And so one of the things that a lot of people that have sickle cell or their caregivers deal with is that when they're going through crisis and they have to go to the hospital or go to an urgent care center or emergency room, a lot of times they're not treated as respectable patients because they are in so much pain. A lot of times, they're perceived as drug users or just want, pain medication when that's not the case. And so it becomes very difficult for a sickle cell patient to be able to advocate for themselves because they're going through this, they're living with this. So a lot of times they know what it is that they need, but when they express that to the medical professional, it's not looked upon as information to work with, is looked at derogatorily. So one of the things that Kemba, along with a few doctors from the University of Miami and from Memorial Hospital, the first year, we didn't really know where to start. So we came up with some legislation and it was really, really broad and it was very difficult to get it moving. So that first year, we put the legislation in, but it didn't move. However, the second year, we narrowed it down. We got it really precise. And what the legislation was going to do, or what we asked for it to do, was because medical professionals have to have continuing education automatically, they already do that. We were asking that they would add a course that will refresh their information on sickle cell so that all medical professionals, when a sickle cell patient comes into their presence, whether it's in the emergency room or it's in a specialty or wherever it is, that they will have a refresher on that and be able to help to treat them more appropriately. That second year, which was last year, we were able to get the bill a first hearing in one of the committees, and it actually passed unanimously.
Wow.
Yeah, exactly. So we was very happy. Kemba and some of her warriors and supporters actually came up and they spoke, and it was very, very impactful. And we were able to get it past that first committee. But then, like I said, it stopped, and it did have two other committees go through. So we're running it again this year, and we're hoping that we'll be able to get it. Now, I can tell you, because I'm very transparent, that one of the pushbacks was that the FMA, which is the Florida Medical Association, who really supports the doctors, they were pushing back because doctors do not want to take additional continuing education courses. So I do believe that played a factor in stopping because of that pushback. However, I have done my due diligence and I've reached out to them and I've been working with them. And so the bill that we're doing this year, it's not going to be a separate continuing education course, but what we have been told they would be amicable for, they'll be willing to work with us on, is putting that education in their pain management course that they already have that they have to take.
Oh, nice.
So what we're looking for this piece of legislation is to not create an additional course, but to include sickle cell education for medical professionals within that course so that they can get a refresher. you know, all of us as we get older and you're working, and you could be a great doctor, you could be a great medical professional, but first of all, you only probably saw it for a temporary or small amount of time when you were in school. And if you're not working with those patients all the time, then there's things that you don't know. So we believe that this will be a win-win on both sides. And I'm really excited to get it moving. And it hasn't gotten a bill number yet. We have put it in drafting, and we're just waiting for, it to get its bill number, and then we'll start advocating, and I'll talk to Kemba, and we'll get people to start pushing it and talking to us so we can make sure they get agendaed and that we can get it passed through the legislature. And so I'm very excited about it because I think that would be a great move in helping. Before I stop, I would also say, though, although we haven't gotten that passed through the legislature in the last, I would say 2 years, we have been able to get some funding for sickle cell, one of which is a grant that I believe Kemba them may be applying for or may have applied for, where it can help organizations to, get money to do the good work that they're doing and other things like that. And we've also been able to have a registry. So one of the causes is, of course, that you can have the trait, but you might not never get the disease. But when both parents have the trait, then it's a higher possibility for the child to actually get sickle cell. Well, now we have here in the state of Florida where all babies are tested and they can be on this registry so that they will know. And it's open to adults that if they would like to be a part of the registry, then they can be also.
Thank you. Wow, that's great. Congratulations and kudos to the work that you're doing, Rep. Robinson, on the state level, because I don't think people really understand some of the stigmas that sickle cell warriors have to deal with. Kemba, can you just share any thoughts on what this legislation will mean for people with sickle cell if this passed?
Yes, and we're so happy that Representative Robinson is definitely one of our champions. And we thank her for the work that she's doing. Now, your last statement, Janey, I just want to give a quote from the New England Journal of Medicine. This is from 2020. Now, this is from one of the most respected medical journals, right? There may be no population of patients whose healthcare and outcomes are more affected by racism than those with sickle cell disease. So you can let that sink in, okay? Just to piggyback off of what was said earlier, we got the pushback from, medical providers with wanting the education. Currently, healthcare providers have to learn about HIV/AIDS, domestic violence, human trafficking, medical errors, Florida laws and rules. So just to let you know, those are some of the things that they are mandated to learn about. So our thinking was Florida has the highest number of sickle cell here. So our disease, our condition is definitely worth knowing about, treating better. And we do have some amazing healthcare providers, as Representative Robinson said. We had some that helped draft this legislation, work together and collaborate. However, we still are lacking in a lot of areas when it comes to stigma, the mistreatment. Even just last week, I personally received 3 calls from individuals that needed assistance and advocacy. And to be honest, it gets a little bit overwhelming, and it hurts sometimes too when you try all you can and you still come up a little bit short, and you may not be able to go all the way like you want to. The bill is not going to solve all of our problems, but it's definitely a step in the right direction. It's definitely a huge step in the right direction, with providers, healthcare providers, knowing about how to treat this condition, knowing what to expect with someone with sickle cell, because what gets missed a lot is they're in pain. But what's causing that pain? Something is dying. You get what I mean? The blood vessels and everything, they're getting clumped together. Organs could be failing. A lot of things could be going on. So the education piece is extremely, extremely important. My daughter personally, I know many warriors who to this day get asked when they go to seek care, how long have you had sickle cell? Now, if you're a healthcare provider, you should know you're born with it. But those are some of the questions that to this day we actually still get asked. So that's why it is so important. This piece of legislation is so, so important. It's a huge step in the right direction. And I think that we can get so much done once we start, going this way.
And I just wanted to say this, if I may, sorry.
Yes,
because, someone that may be listening might not understand. They might think, well, they're doctors, they're supposed to know. So again, if you are a doctor that work with sickle cell patients on a regular basis, you do know, because that's your specialty. That's where you are.
Mm-hmm.
This comes into play when, like I said, you're going to a specialist for something else, or you're going to the emergency room, that those doctors are not seeing sickle cell patients on a regular basis. And so that's where the issue comes into play, because they're not used to treating them. So then when that patient comes, they're treating them, in a different way.
No, thank you for breaking that down.
Definitely. And you know what? Studies have shown that people with sickle cell are no less prone to addiction than the general population. That's a very big misconception. And that's data on that is incorrect.
I think I find it really, and the more that I learn from you, Kemba, like, I find it really odd that this group of people would be categorized in this way, but it also, too, to me, goes to show like systematic racism in our healthcare system, because I can't imagine another illness that has chronic pain where people would be denied pain medication. Like, because like I'm just like, that's mad wild to me. So I'm so glad that you all have this legislation that at least the healthcare professionals will be up on what is needed to treat sickle cell warriors. Rep Robinson, I would like to know, because a lot of times as people in the community, we don't know how to support what's going on when it comes to bills that are being passed in Tallahassee. If someone, wants to support your efforts, you and Kimba efforts, like, what could that look like for the everyday person who believes that this bill should get passed? Like,
I would tell them to reach out to, they could definitely, I would say, connect with Kemba, if for one, but then on our level, the process of getting a bill passed is to first get an agenda. So once that give me a bill number, you can actually go to the House site and you can see that bill. You'll see what committees it has to go through. Last time it had to go through 3 committees. And each one of those committees have a chairperson, has a vice chair, has a ranking member. So usually I start there. I start trying to talk to that chairperson, explaining what this bill does and how important and how it's going to play an effect on the residents here in Florida. And I'm doing that to ensure that that bill can actually get agended. Just because you file a bill does not mean that the bill is going to automatically be heard. And so that's the first thing. So once we get our bill, I reaches out to Kimba. I let her know this is our bill number. And then I get to work in the Capitol. And then sometimes I might ask them, send an email, do a phone call. To just support the efforts that I'm doing, so that I can get the chairs to understand that this is not something that I just want to make it sound good or look good. This is something that actually affect everyday Floridians, and they want this, and I'm just their voice. So on all of our bills, if it's something that you're trying to get passed, do not be afraid to reach out to the representative that's on that committee. I always reach out to the chair first, because they're the person that control the committee. But then you can reach out to those members and give them your personal stories, or who, just like almost, I wear pink all month for breast cancer, but sickle cell is just as important. And everybody has someone that they know that's probably been affected by sickle cell, whether they acknowledge it or not. Someone knows someone, because it's a disease that people, sometimes they live in silence. They don't even want to tell people.
Yes, definitely.
And so I would say the best way to advocate is to support ASAP, but then also look at the legislation, see who it is, send a letter, give a phone call. You can always reach out to my office if you need some direction. I always have someone, we always answer our calls and get back with you. But it is important for everyday people to get engaged on every level. And I really like, if you ever look at the type of legislations that I present, I go across the board, because I try to make sure that I'm having an impact across the board. And politics is not something that just sits in one area.
Mhm.
It affects us in healthcare. It affects us in business. It affects us in education. When we talk about politics, it plays a part in all of our lives in everyday things. So I really try to encourage people to get an understanding of that, and to be, more importantly, get engaged in it, be a part of it,
Mhm.
let your voice be heard, whether you are making that call yourself, you're sending that email yourself, or you're talking to your representative to say, hey, this is really what we need. That's what's most important.
Yes, and I just want to call out some of the comments because people are loving this conversation. K Spence 0304 said, great discussion. The Voice 305 said, 100, you need credible reps in office for people and reps passing important bills and not just bills being passed by the parties. And Faith M said she had nurses and doctors tell her that she was their first sickle cell patient. So it's kind of, and Levi Collins was saying that's wild in regards to people, not giving people the pain medicine if they have sickle cell. And then Tontis was saying, what kind of doctors are not treating people because they're not up on sickle cell? Feel free to consult with another doctor. So I'm so glad that you guys have this conversation going in the comments and people are really, buying into this. I think there's a part 2 to this conversation as the bill gets a number, and then even
Yes.
to Rep Robinson, like kind of giving our audience how to support bills that we want to see passed and what that looks like. Because even me, even though I kind of know, but I didn't really know to say, hey, reach out to the chairperson of a committee if you want a bill passed. So I think there's some education that we all could have in regards to this bill in particular, and then just in bills as a whole. So I hope that we can, do a part 2 and part 3 to this conversation, because it's really, really needed in our community. Because sometimes people just don't know where to begin. They want to help, but they don't know how to help.
And I totally agree with you in that statement. I always say that I personally believe, and I know this for a fact in the years that I've been around, is that when people know better, they do better, whether they know or not. They do better because of of the knowledge that they know.
Mhm.
So I'm always trying to educate people. So if you want me to come back in any instance on anything, I am always definitely willing, because I know that when our people understand what's going on and it's presented to them, that they will act.
Yes, no, I love
Yes.
that. And Kimba, I want to switch gears a little bit because you have a celebration of Sickle Cell Warriors coming up, a 10-year anniversary for the ASAP organization. Can you tell us what people can expect when all of that is going down? Give us some of the details on that. And just, congratulations to you on 10 years of service to our community in this space.
Thank you. And shout out to the whole ASAP team. It's not just me. Thank y'all so much for all of y'all support and hard work. I'm not going to lie. It hasn't been easy always keeping this going for 10 years. It has not. But we're blessed. I'm thankful. We're all grateful that we're still here, and the best is yet to come. So less than 2 weeks, on November 9th, we're having our 10-year anniversary Comedy for a Cause fundraiser anniversary at the Dania Improv. The doors open at 12. The show starts at 1. And we're very, very proud that we have a sickle cell warrior coming all the way from Compton, California, who's our headline comedian. He also has a movie that Marlon Wayans co-produced with him called You Look Fine. And it's all about his journey with sickle cell disease. So he's
Really?
our headline comedian. Yes, that gives us so much inspiration as a caregiver, as a warrior. And we're asking everybody to come out and support. It's a Sunday afternoon. It's the support for a good cause. You're going to have laughs. You're going to have food. You're going to have fun. And also, there's going to be some reflection and highlights from the work that we have done for the last 10 years. Rep is going to be sharing a few words also at this event. Y'all want to see her come too? So, yeah, we're excited. This is a fun event. A lot of times we have panels and it gets real heavy and things like that. But at this event, we're here to laugh, have fun, reflect, and just be thankful.
Yes. And so is there, I know this is a fundraiser, so let people know about like the entry fees, and if they can't make it, how can they donate? If they're a business, how can they sponsor? Let people know how they can, support what you guys are doing financially, because we got to support with our dollars in our community. We can't
Yes,
just
that's what
always
helps
be
us
looking
keep
for
going.
freebies.
Absolutely. That's what helps us to keep going. So the early bird tickets are only $25. They're closing this weekend, but they can go on. I don't know if I could put it in the chat to see. I can share the Eventbrite link here. Also,
Okay, and what I'll do too, because I have the flyer on the screen, and I'll try to copy it and get it into the chat for people for you.
Okay. They can always reach out to us on Instagram, Facebook, TikTok, whatever platform you have at ASAP Be Informed. You can reach out to us if you're interested. Yeah, and if you want to donate a ticket to a sickle cell warrior to attend, that's fine. We accept that. Even if you can't make it, we know everybody is busy. But if you want to donate and support, that way you can. They can reach out to us by email at info@asapbeinformed.org as well if they're interested in being a sponsor. We're on all, we have Zelle, all that information. So if you're interested, you can DM us or send us an email at asapbeinformed, and we'll be more than happy to share that information with you. Again, the early bird tickets are only $25. VIP is $45. And like I said, it's for a wonderful cause. If you want to support any of our other initiatives, you can reach out to us at info@asapbeinformed.org as well, and we can send information out to you. Oh, someone put it in the chat.
Yes, someone put it on the screen for it. Thank you,
Right.
Mellow587.
That's one of our Hispanic warriors. Hi.
Hey, what's up?
Yes, Anais. Hey.
Oh, so here's the thing. So, and I know this is maybe a little ignorant of me, and I know this doesn't only affect African Americans or Black people, but does this affect our Hispanic brothers and sisters as well?
Absolutely. That was a great segue when she put that in there. So for me to recognize that, absolutely. Anais is a Hispanic warrior. She has sickle cell disease, and definitely that's one of the misconceptions, that this is a Black disease. And it's not. It affects people of the Mediterranean, Indian, Saudi Arabia.
Anyone of color. If you have a little color, melanin, you have that possibility.
So white people don't get sickle cell.
Well,
rarely.
Well, I'm gonna be honest. In our tree, if you shake that tree, we're not sure what might fall off. We don't know our history, you know.
That's
you
true.
May look
it may be some Black blood or something in there.
Exactly.
Yeah, we know slavery made a lot of mixing and things, and people don't know what's in their family tree. But for the so historically, and the data shows that it's mainly people of color who get sickle cell. Is there a reason why it affects Black people or people of color more than it does, our non-Black counterparts or non-people of color? Like, is there something with that our body creates or produces? Because like my aunt doesn't have like the disease, but she has the trait. So it's like, what is it like? Is there something that comes back maybe from Africa that we carry that causes this? Like, what have you guys learned in that regard?
Yeah, we actually have a video up on our page too from Dr. Alvarez breaking that down. I can't break it down exactly as great as she does, but definitely yes. Like I carry the actual gene, like you said, your aunt. I think you said your aunt. She also carries the gene. So we carry the gene for sickle cell disease, meaning if we have someone that has the trait, we have a 25% chance each pregnancy of our child having, actual sickle cell disease. Also, people think that if you have the trait, you're in the clear. But I just want to say too, that with the trait, you have to be cautious as well of being dehydrated, overexertion as well, because we have lost some athletes due to having the trait. And so now, yes, the NCAA tests all athletes for the trait now, because they have lost some because of that reason as well. So even with the trait, you still have to be educated, and we encourage everyone to know your sickle status.
Yes.
I like that. Know your sickle status. I think my mom told me before that we don't have it, but now I just want to make sure, because like I said, my aunt has it. But to your point, not knowing if you have the trait and how it could affect you. So again, I just want to appreciate you ladies for the work that you're doing. Also to Rep Robinson for showing us, because we always talk about this on our shows, especially the show I do with Papa Keith and this show, about how policy affects our everyday life. It's not just the drama we see on TV. This is something real that affects our neighbors, our family, ourselves, that you're trying to put policy around to help people. So definitely want to thank you ladies for the work that you're doing in this regard. Any final thoughts before we end the conversation? Anything coming up or anything that you want the audience to know? And Rep Robinson, I'll start with you, and then Kemba, we'll go to you.
Well, a couple of things. One of the things I wanted to say, as you all said, you said you want to know your status. I thought that was a great segue to say that it's really important for us to go to the doctor. We walk around, we think we're fine, we think everything's okay. However, it's so many of us that don't go to the doctor, and we don't go until we get sick. People, please, if you don't do anything else, I know this month they recognize breast cancer, and we're here talking about sickle cell. However, October is also Take Your Loved One to the Doctor month. We used to do that a lot. So if you're not going to the doctor, you don't have a primary care doctor, or you don't have insurance, we have community health centers. We call them CHCs here, and they will see you regardless on whether you have insurance or not. I know I sit on the board for one Center for Family and Child Enrichment. We have a community health center. We have Jesse Trice, and we have a few others. Please, if I can't say anything else, take the time out to love on you. Take care of yourself and just check yourself out. And one of the things you should do is know your status about a sickle cell. The next thing I would tell you, just to give you some insight, a lot of times people that normally would see me in Miami Gardens, a whole lot of see me in Miami, like sometimes they would say, well, I haven't seen you. And you don't see me because I am a state legislator, and we go back and forth to Tallahassee. So actually next week I will be in Tallahassee the whole week. We have committee weeks right now. Session has not started. Session will start January the 13th. But right now we're in what we call committee weeks, and we have 6 committee weeks before session. So we started committee weeks in October. I was there 2 weeks in October. I'll be there 2 weeks in November, and I'll be there 2 weeks in December. So it's back and forth, back and forth. So you might see me and then you don't see me, and it's because I'm probably in Tallahassee. And so that's that process. And we're in committee. What we're doing is we have workshops. We're starting to look at legislation. We're doing all those things. And then when session comes, we still have committees, but we have committees and we be on the floor and we start passing things and we start working on the budget and things like that. So that's what I'm about to go into. Things that I will tell you to look forward to. I know that just with the way the government is right now, I know everybody knows about SNAP. My office, we usually have a food giveaway the first and third Wednesday in partnership with Harvest Helping Hands. Exactly. We do that every first and third Wednesday, of the month at my office. And we're going to continue that. And we're trying to work with other people to try to fill in the gap. Some for people that may lose their SNAP and things like that. I am working on doing a dinner for some people that may not have SNAP. I'm working on that presently. Once I get it together, I will let you know, Janey, so you can put that out. But
please.
That's it. You just have to really stay engaged and pay attention. And if you ever have any questions that's dealing with government or around legislation, please do not hesitate to contact me, contact my office. Even if I don't know the answer, I will find it out, or I will connect you with someone that can help you. But it's better for you to know than to not know.
That part.
Absolutely. Thank you.
Kemba, any last thoughts?
This is an amazing organization. I'm just saying, this is an amazing organization. And I think that everyone could at least give $25 to be to that impact. We should sell out. So we waste $25 all the time. So let's go ahead and get those early bird tickets and show up for a great cause.
Thank you so much. And thank you, Rep, for all the work you do in our community, not just for sickle cell, but for our community as a whole. Thank you. So, and Janey, I think earlier, I don't know if I answered your question all the way, but sub-Saharan Africa is where sickle cell originated from. So,
okay.
With that being said, I think that Anais put in the chat how they can follow us. Please follow us, because when this bill gets the number and everything, we need all the boots on the ground, okay? Not just with the fan, but we need all the boots on the ground to help spread the word about this, help support. You don't have to know someone with sickle cell. If you're on this podcast, you already know about sickle cell. So tell someone else about it and how we can support, because we cannot do this by ourselves. It takes all of us literally working together to make a difference in the sickle cell community. So We don't want to pass the baton to our younger warriors that are coming up. They're getting ready to transition to adulthood. We don't want to pass the baton to them and say, hey, expect all of these issues when you become 18 and you go seek care as an adult. We don't want to do that. We have to be the change that we want to see. And so that's what we're doing right now, working with Representative Robinson, working with the other partners that we have to try to make a difference. So please follow us on social media. Please also email us so we can get on our mailing list, so that when we distribute this information and disseminate it, you will have it. So you can also help us as well. And I hope to see you on November 9th as well.
I think I'll be in town. So like I said, if I'm in town, I'm gonna pull up on you. But however, just to hold me accountable, I am going to sponsor 3 tickets to the gala. So Kemba,
Thank
get with me
you.
into Miller so we can make sure we can get that donation. Guys, as
Okay.
you guys were talking, y'all know in the Black community, we big on giving our offerings and tithes and offering to church. And I think we should think about our nonprofits like that too. Give an offering to causes that are close to your heart, that maybe speak to you, maybe touch your family. So to me, I don't have a church home, but to me, I'm like, giving to nonprofits is my way of giving offerings and giving my tithes and keeping that energy of giving. So I would encourage everyone watching this to give an offering, to give a donation to the ASAP for their 10 years of work in this community. And guys, let's make sure we support this. And like Rep Robinson said and Kimber said, this could easily be sold out. We eat $25. Like I ate $25 a day for lunch. Like, so that's, I'm like, I can easily give $25. I literally ate that for lunch. So I can give that to a cause that are helping people, especially people that look like me. We could definitely give that from High Low News and Take Media Enterprises. So I would encourage anybody else at the sound of my voice to do that, and also to share this interview, share this broadcast with other people so that they can get this information, because this is vital, real information that we can use tomorrow, right in our, right now, use it in our arsenal. So thank you, ladies, for being on the show, and just always thank you for sharing this vital information. We need to know this stuff in our community.
Thank you for having us.
Thank you for doing a great job in educating and keeping our community aware. Thank you.
Thank you. Oh, I love it. Love it. Look at this Black girl magic. Love it. Yes, come on. Levi said he gonna donate a ticket. Hey, come on now. Look, come
Yes.
on,
Thank
donation.
you.
Come
Thank
on.
you. Hallelujah.
I love it. I love it. Thank you, guys. Keep us posted. Send us a post release, Kimber, as well, if I can't make it to the event.
Okay.
So that we can at least share with the community what took place at the event.
I will. I most certainly will do that.
Yes, thank you. And the food drives, Rep Robinson. I want to make sure we get that out there, because
Yes, we
Snap is
need that
about to
information. We
snap in
need that.
half. So we got
Yeah,
to make
I
sure the
think
people know where
my
to get their
staff put
resources.
it in the my staff put it in the
Okay,
my
so that
staff
was your
put it in the chat, but I'll have her send it over to you also.
Okay,
Yeah,
cool. Now I'll make sure
but
I
I'm positive
put that
I'll
on the
have her
screen
send you
again.
over a flyer.
Okay, cool. Yay.
Okay.
Let's do that.
Awesome.
Thank you, ladies. I appreciate you for coming on the Can We Talk podcast, powered by High Low News. Y'all know y'all friends of the show. So come back anytime you have information and that we need to share with our audience. Today, the audience was loving what you guys were sharing, and I appreciate you guys for coming on.
Thank you.
Thank you.
Y'all give them some love in the comments. Hey. Bye, ladies.
All right. Bye.
Man, I love when Kemba comes on. And I think that was actually one of my first interviews with Rep Robinson in a while. So I'm glad we were able to have this just loving conversation and important conversation about sickle cell, because of how it affects, the Black community and the brown community. We need to make sure that we know what's going on. Yes, I love the love that y'all had in the comments. Yes. Hey, auntie, what's up, Faith? Yes, Black girl magic for sure. Yes, we're gonna make sure we donate to causes like that, because every time when I first learned that they stigmatize sickle cell warriors and say they don't want to give them pain medication, and we all know that's some mess, some racism mess, because it's people of color, primarily Black people, who have this issue. So you think that they don't got a pain pain medication addiction. Come on now, people could prove to you that they have sickle cell, you still don't want to get them the medication. Come on. And it's just the fact that the doctors don't know. Like, we're just, and the crazy thing is too, is like, sometimes we don't understand, if you're not in it, you don't understand how like it affects people, or you just assume that a doctor would know about sickle cell, right? Because they go and learn about all the diseases. So you would not expect a doctor to be ignorant, so to speak, to a disease that so many people have. So very, very poignant and important conversation that we have. Yes, thank you. So shout out to the Sickle Cell Warriors and the ASAP team who were watching today. I appreciate y'all. Thank y'all for having our numbers go up. I appreciate y'all. What's up, Miss Alma Brown? I see you, Miss Alma. Come on, hey, I love it. I love it. Shout out again to Brett Robinson and Kemba for a great, great, great informative interview.